So you're standing at the pharmacy counter and you pull up the GoodRx coupon on your phone and you're trying to decide, do I show the coupon to the pharmacist or do I just let this run through my insurance company? The honest answer here is that sometimes GoodRx wins and sometimes your insurance does. Sometimes what's the cheap option this month is the expensive option next month. And so today, I'm going to show you exactly how to tell the difference before you pay. So let's go ahead and walk through this. We'll start by just kind of going over some of the issues that you're going to run into, right, as you're trying to make this decision. But first and foremost, I'm going to use the term GoodRx. I am very well aware that there are multiple pharmacy coupon programs out there that you can download the app. Some of your insurance companies may promote a different company, but just for the general conversation, I'm typically going to utilize GoodRx, okay? So the first thing that I do want to touch base on is GoodRx is not insurance. It's a discount coupon, and so you're basically paying cash out of pocket at a negotiated price. And it changes, right? That's the other thing that you run into with GoodRx. It changes often. The price that you see for the prescription meds at GoodRx today are very well going to be different tomorrow or the next day. It's going to be different at a CVS than it is at a Walgreens than it is at a Walmart. And it could be different at the CVS down the road from your house than it is at the CVS that's a block away from where you work. It really changes a lot. It's surprising. You would think that it's a discount and it would be a blanket discount, but it's very contingent on geographic location and where you're going into. The other thing to note is the copay or co-insurance that you're paying through your insurance company, that's not a set number either, right? If it's all based on their formulary. If it's a generic drug, you may be paying, X dollars, and if it's a specialty drug, you're most likely going to be paying a lot more. Even percentage of billed is what we're starting to see. The other thing that you need to realize with GoodRx, and this is something that I think a lot of people don't realize right up front, is GoodRx does not go through your insurance company. It's outside of insurance. So the money you're spending utilizing the coupon programs does not go towards your deductible or your out-of-pocket max. And this is something that you really want to be thinking of. And we'll go into a little bit more about that in a little bit. But it doesn't. It's outside of insurance, and it typically does not get reported to your insurance company. The other thing is the pharmacist in most states legally cannot volunteer the cheaper option. They're allowed to talk about it, but somebody has to bring it up first. And then the other thing is sometimes the cheapest option isn't GoodRx or another app-based, discount program, and it may not be insurance. It could be not the carrier, but it could be the pharmacist's actual cash price. It could be a coupon that you get directly from the manufacturer. It could be a 90-day supply through mail order. There's a lot of different variables here, and like I said, GoodRx or those web-based coupon programs aren't always the best way to go. So it's a lot of information. There's a lot of pricing that just is not fixed. It's very flexible. So what can we do here, right? The first thing you want to do is when you're at the pharmacist, ask for all three prices right out of the gate, right? Before you pay, ask the pharmacist what the GoodRx price is going to be, what the cash price is, and what you would pay if you utilized insurance, right? Because you're allowed each time to pick the cheapest option for you. The other thing, and I mentioned earlier, and we want to think about this, and this is a little bit more of a deeper, more strategic conversation, but I do want to bring it up now, is that if your prescription drugs are going towards your deductible or your out-of-pocket max, and we're seeing more and more prescription drug co-payments and co-insurance, and also more deductibles on prescription drugs, where we didn't see that historically, we're definitely seeing more plans out there that have deductible first on prescription drugs. This requires a little bit of planning, a little bit of foresight on your part, because if you're in a position where maybe you want to satisfy that deductible as soon as possible, maybe you have a $2,000 or $3,000 deductible and you want to have that paid down eventually because you're going to have a procedure later on, you may very well want your prescription costs to go towards that to winnow down that deductible. But again, that's a deeper, more strategic conversation. That's something that we at Cornerstone Health Advocates would love to help you with. If you find yourself in that situation and you find it a little too confusing and it's just overbearing, reach out to us. That's what we're here for. The other thing is, you want to always, these are definitely one of the areas where I just think that you just want to always run controlled substances through your insurance company. These are things like Xanax, Adderall, any type of pain medication like a Percocet, because the reason is when you go through GoodRx, again, that's not necessarily always reported to your insurance company. So when you're utilizing a service like that and you're taking a medication like a controlled substance, those are the situations where you actually really want your insurance company to know all that data, because they need to monitor it, number one, and they need to make sure that there's no major drug interactions. So if you're on one of those, again, controlled substances, you really want that to always run through your insurance company. It's the best approach and it's the safest approach for you. Another thing to do is don't wait till you get to the pharmacy to do all this. This is research that you can do ahead of time. So, before you're going into the pharmacy to pick up your prescription drug, take a few minutes, open your phone, check out the GoodRx or whatever copay program that you're using. Check that price out. Go to your insurance company and look up the formulary. Go to your app or on their website. Look up their formulary to see where it's going to fall and what you're going to be paying for your copay or co-insurance there, or if it is a deductible expense. The other thing is you want to look at things like Mark Cuban's drug program that he has out there, if you're taking a generic, or even the new Trump RX, right? There are other avenues to get discounted rates on prescription drugs. So take a few minutes and do that little bit of research. It will just save you a little more time while you're at the pharmacist. And it might be a little bit easier, especially if you're sitting there and there's a longer line and you don't really want to feel like you're holding people up, but you also want to make sure you're doing your due diligence and you're not paying any more than you need to. So this is a lot, and I understand the current state of our insurance, kind of makes things a little more confusing for you, and it actually makes we're responsible for more out of pocket. So if you're juggling a few different medications and you're not sure which ones should go through GoodRx or directly to your insurance, or maybe even through another program, that's exactly the kind of things we want to be untangling for you at Cornerstone Health Advocates. Again, we'll sit down with you, we'll look at your medications, we'll look at your plan, and we'll put together a little bit of a roadmap. So at least you'll understand things a little bit better and you won't necessarily be as confused when you get there. We are a nonprofit and your first consultation is always free, and any type of follow-ups are on a sliding scale. And again, we will never turn you away because of your inability to pay. So don't let any of that be a barrier to you reaching out to us. We are here to help. So if you want to book a consultation, the link will be down below in the description of the video, as will a link to our free medical bill review checklist. It's a good checklist. I recommend everybody just go in, download it. It's a great resource to have. So thank you very much, and you guys take care of yourself.